How would you feel if one day you needed to wait for something that you really need? What if you could not live without it? When I was 29 years old, waiting at the hospital for my sister to deliver her baby, I noticed a distressed lady standing in the corridor, tears streaming down her face. Curious, I approached her and inquired about her situation. She tearfully explained that her 5-year-old child has been involved in a car accident with her husband. While her husband escaped unharmed, her daughter was in a critical condition and urgently needed blood. Unfortunately, the hospital had no blood stock and she was placed on a waiting list. Filled with empathy, I asked the lady to accompany me to the doctor to check if I was eligible for blood donation. And fortunately, my blood was a match for her daughter's, and I was able to make my first blood donation that day, saving a precious life. Ladies and gentlemen, the reason I'm standing here is to encourage you to become a blood donor. All of us have studied how blood is important for our body to function properly, and if there is a lack of it or deficiency in our blood, then we get disease or even our life can be in danger. In severe accidents and blood loss, people need blood transfusion urgently, and there is no time to search for donors. They might be our family members, neighbors, or even witnesses accidents. This life can be saved if the blood bank have enough blood to provide for this patient. According to this graph from the National Blood Center, Ministry of Health Malaysia, the number of new donors decreased from the year 2012 to the year 2024. Ladies and gentlemen, it has come to my attention that this structure, which most Malaysians are not aware of, is important for becoming a blood donor. This is reflected in the declining number of donors from year to year. Right now, the need for blood is greater than what the blood bank can provide. Do you know where the blood in the blood banks come from? It comes from you and me. Yes, people like us are the ones who provide blood for this patient and save their life. Ladies and gentlemen, why do we need to become blood donors? Blood cannot be manufactured. It can only come from volunteer donors. 3 teaspoons of blood can save a baby's life. 1 pint of blood can save up to 3 lives. Every 2 seconds, someone needs blood. Adults have around 10 pints of blood in their body. Only 1 pint is given during a donation. This process takes only 10 minutes and is pain-free. You can donate blood every 3 months. Rather, you get stronger, and it helps the donor by rejuvenating the body and donating blood, even reducing the risk of heart disease. Some of you might be interested in becoming a blood donor because of encouragement from people surrounding you, camping, maybe social media. However, I also know some of you are still uncertain. Allow me to persuade you more by telling you the importance of becoming a blood donor. First, becoming a blood donor is seen as a selfless, altruistic, and noble act. You are helping others in need without expecting anything in return. You do good for others. Donated blood can save the life of people in need. Remember, every drop of blood donated is the ultimate gift of life. Donated blood is used in medical treatment to save life. It is essential for surgeries, trauma care, cancer treatment, and various medical conditions. In cases of accidents, natural disaster, or emergency, blood transfusion may be urgently needed. Having a steady supply of donated blood ensures that hospitals can respond effectively to such situations. People with chronic illness such as sickle cell anemia or thalassemia often require regular blood transfusion to manage their condition and improve their quality of life. In addition, many medical procedures, including organ transplant and certain surgeries, require blood transfusion to replace blood loss during the procedure or to support the patient's recovery. Blood has a limited shelf life. typically around 42 days for red blood cell. Regular blood donations are necessary to maintain an adequate supply and prevent shortages. Different patients require specific blood types for transfusion. By donating blood, you contribute to a diverse blood supply that can meet the needs of various individuals. In addition, blood donation makes the work of blood banks easier. It stabilizes their collection, which helps other people get blood urgently. The demand is still higher than the supply in blood bank, so we must donate more and more to help people. When you donate blood, your body replaces the blood volume within 48 hours of donation, and all the red blood cells you lose during donation are completely replaced within 4 to 8 weeks. This process of replenishment can help your body stay healthy and work more efficiently and productively. What are the benefits of donating blood? Donor satisfaction with the last donation was high, and most donors felt very safe. It revitalized our body for better health. In other words, blood donation does not simply help that specific person but also contribute to a responsible gesture towards society. Moreover, blood donation enhances the health of the donor and help us know about our bodies. As blood donation requires a preliminary health checkup, we get a complete diagnosis. It makes us aware of the level of iron, hemoglobin, cholesterol, and more. Blood donors in Malaysia are entitled to many medical privileges, such as free outpatient treatment and hepatitis B vaccination offered by the Ministry of Health. Before every blood donation, blood donors also get a free medical screening that includes measuring blood pressure, pulse, and hemoglobin levels. Does donating blood cause no harm? Yes. Remember that you will only be accepted as a blood donor if you are fit and well. Your health and well-being are very important to the blood service. The needle and blood bag used to collect blood come in a sterile pack that cannot be reused. So there is no risk of getting a blood-borne infection by donating blood, making the process as safe as possible. Some blood donors may encounter mild adverse effects such as dizziness, bruises, or light bleeding. Adding more water and eating foods high in iron will help replace lost fluid and iron reserve. Blood donation is safe. Ladies and gentlemen, this visualization shows that every year on June 14, World Blood Donor Day is celebrated throughout the world. This event serves to raise awareness of the need for safe blood and blood products and to thank voluntary unpaid blood donors for their life-saving gift of blood. The global theme of World Blood Donor Day changes each year in recognition of the selfless individuals who donate their blood to people unknown to them. Everyone may become a savior. I would like to conclude my speech by saying that blood donation is a very noble cause, and if you can save the life of others, you are no less a lifesaver than the doctors. We might not become doctors, but all of us can help the doctor by becoming blood donors. Blood donation is a friendly gesture. If you have donated blood even once, you are a special person, and your action is priceless. Blood owners should be blood donors. Keep blood bank shelf full. You may need blood someday. Join the effort and save life. Thank you. Any question from the audience? Yes, please. Yes, I have been a blood donor for 16 times.